Hi, this is Dr. Bharadwaj as a part of Homeopathy Pharmacist course. Today we are going to discuss about medicine. I am subject expert at Homeopraxis Academy. So we will understand what is medicine. In homeopathy we talk about medicines, right? There are different types of medicine. Let's understand what is medicine. The agenda for the day is what is medicine. You have to understand what are the components of the medicine. One is active ingredient and one is excipient. We will look deeply into these three topics today. First one is medicine, right? What is a medicine? Medicine is any substance you take in the world. If it can prevent a disease, means it stops the disease from occurring. It is also known as medicine. It can cure the disease. You have a disease and you are having some problem. This problem has to be reversed, or you have to go to the healthy state, that is cure. Any substance that is used to cure a disease is also known as medicine. One is relief. Sometimes some diseases cannot be cured. For example, HIV cannot be cured, but you can use the medicines for HIV and ensure that you have complete relief. There is no deterioration of your health. So that is known as relief. Without curing, when you relieve just the symptoms, it is known as relief. Any substance that can help you in preventing a disease, curing a disease, or relieving a disease is medicine. What should it prevent, cure, or relieve? It can prevent the sign of a disease, symptom of a disease, or entire disease itself. What is a sign? Sign means what you observe in a patient. For example, the patient has come, there is an injury on the patient, you can see it, that is known as sign. What is symptom? Symptom is subjective experience. Patient says, I have headache, you cannot see the headache, right? That is a symptom. And disease, as per DSM-5 or ICD-11. So as per DSM-5 or ICD-11, there are some diseases. If you can cure the disease, prevent the disease, or relieve the disease, that is known as medicine. Next one is, there are two components in the medicine, right? Any medicine you take, there are two components. One is active ingredient, one is excipient. You can see medicine here, and there are two components of the medicine. One is active ingredient and one is excipient. We will clearly check what is active ingredient and what is excipient. First one is active ingredient. What is an active ingredient? The part of the medicine that has therapeutic effect. Therapeutic effect means the part of the medicine that ensures that the person is prevented, cured, or relieved of a disease. That is known as therapeutic effect. Okay, the part of the medicine that produces this effect is known as active ingredient. In homeopathy, there are two types of active ingredients. One is the active substance exists in the form of crude substance or in the form of nanoparticles. This crude substance is present in mother tincture. Normally, there are different types of medicines in homeopathy. Mother tincture is one of the categories. In mother tinctures, the active ingredient is present in the form of crude substance. But in dilutions, triturations, there are also type of medicine. The nanoparticles are existing. So in homeopathy, there are two types of active ingredients, that is crude substance or nanoparticle. So what is crude substance? Any active ingredient that exists in unprocessed form. There are no processed forms, right? You take the medicine from plant, you use as it is. You are not converting into nanoparticles. Nanoparticles are nano-sized particles which are very small, which are not visible to the eye. Those are nanoparticles. When you convert these medicines into nanoparticles, then that is known as nanoparticle. If you don't convert and directly use it as a raw material, then it is known as crude substances. Normally you see that crude substances are used in allopathy, or even crude substances are used in other systems of medicine. Homeopathy also uses these crude substances, but the specialty of homeopathy is, apart from crude substances, homeopathy also uses nanoparticles. They convert this crude substance sometimes and use it as nanoparticles. In homeopathy, the active ingredient exists in two forms. One is crude substance and nanoparticles. This crude substance is present in mother tinctures, and these nanoparticles are present in this dilution or trituration. What is the difference between crude substance and nanoparticle? Crude substance is in the form of molecules. For example, let's take a drug, sildenafil citrate, normally known as ozomen. Okay, normally men use it. Ozomen is a substance, or sildenafil citrate is a molecule or a chemical substance. What allopathy does? Allopathy gives this chemical substance directly into you. But what homeopathic does, it will convert into nanoparticles. Nanoparticles means if you take the same medicine and you convert into nanoparticles, nanoparticles have a structure. See, nanoparticles, they will be active ingredients, sildenafil citrate in the center. On top of it, it is covered by lactose layer. On around the lactose layer, there will be silicon chain. Okay, there is silicon. Okay, this is lactose, and this is active ingredient. Active ingredient is this molecule, sildenafil citrate molecule. Ayurveda, Unani, Siddha all uses this crude substances, but homeopathy converts these crude substances into nanoparticles and use it. This is the active ingredient in homeopathy. That is the main difference between allopathy and or homeopathy and other systems of medicine. In homeopathy, the active ingredient is present in both the forms, as a crude substance, as in mother tincture, or in nanoparticles, as in dilutions and triturations. But allopathy, Ayurveda, Siddha mostly contain crude particles. But there are some instances where other systems of medicine also use nanoparticles. That is very rare. But in homeopathy, 99.99% of the medicines are nanoparticles. In other systems of the medicine, 99.99% are crude substances. When you use nanoparticles in homeopathy, that's the reason, one of the reasons why homeopathy doesn't have side effects. Then excipient. Excipient is one of the components. One is active ingredient, one is excipient. Excipient is any substance that is added to support the active ingredient. There is active ingredient, this nanoparticles or the crude substance, which helps in supporting these nanoparticles or these crude substances, is known as active ingredient. In homeopathy, we use commonly these 5 types of excipient. First one is water, next one is alcohol. Aqua alcohol, you mix water and alcohol and use it as an excipient, and also lactose and sucrose. So what are these? What is water? Water, water is used in dilutions and mother tinctures. Dilutions and mother tinctures are a type of homeopathic medicines which contain water as excipient. And alcohol, same thing. So dilutions and mother tinctures contains alcohol as well. So the term, when you mix water and alcohol, that is known as aqua alcohol. Aqua alcohol is used in dilutions and mother tinctures. Basically these 3 are same. Then what is lactose? Lactose is a powder made from the milk, right? When you use that powder and you add active ingredient to that, then that is known as lactose. Normally we use it in trituration. Trituration, lactose is used. This lactose acts as a excipient for trituration. It contains nanoparticles. These nanoparticles are present. These nanoparticles are stabilized in lactose excipient. And also sucrose. Normally you see small white globules homeopathy doctor gives, right? Those are very small. Those are sucrose. They doesn't have any medication. This medication is poured into that, so that these nanoparticles are supported by this sucrose. Sucrose is sugar. This sugar is made from sugarcane. There are when you go to homeopathic doctor gives you small white sweet globules, right? Those are known as sucrose globules. How are they made? They are made from the sugarcane, or it is just a sugar, but it is a high quality sugar, pharma grade sugar. In that you add medicine. That medicine contains nanoparticles and this sucrose supports that nanoparticles. That is the reason here sucrose is an excipient. Here lactose is an excipient. Lactose is normally used in homeopathic triturations. Triturations are a type of medicines. We will look into it. Globules are also a type of medicines where homeopathy doctors use us. Basically, you have to remember 2 things. What is medicine? What are all the components of the medicine? Active ingredient and excipient. What are all the different types of active ingredients we have? What are all the different types of excipients we have in homeopathy? It is very important for you to understand as a pharmacist. You can contact us on www.homeopraxis.com or +91 7997 101 141. Homeopraxis Academy, evidence-based science, education, research, implementation. Thank you.